that surgery and high-level hand surgery, that's about as hard as it gets. There's not much in my field that is more difficult than that. We had him in the OR about 3 hours after it happened, maybe 4. And there's obviously a time-sensitive component to these types of injuries. When you amputate a part of the hand or any part of your body, the vessels change. They slowly undergo a process that prevents them from accepting new blood flow even after you hook it up. And so you got to intervene before that happens or while it's happening. And if you don't, then it's unsuccessful. In this case, it was a large saw blade, which means there's a lot of tearing of the tissue, and those vessels shorten. They retract basically after you cut them. They retract, and so they're hard to find. And finding good vessels is a very tedious process, and you also have to be very gentle in your search, because when you're looking for them, if you disrupt them inadvertently, that could sink the whole process, the whole surgery. Within 48 hours is the time period where most replantations go down, meaning for whatever reason, the vessels, that process that's ongoing immediately when you cut a vessel is more powerful than your repair sometimes, and a clot develops, or another process happens that impedes inflow. Sometimes the outflow of the vein is impeded, and that can cause problems too. So it's a very tenuous 2 or 3 days after surgery. Once you make it out of that 2 or 3 day window, things are starting to be on the up and up. But he came back within a few days to therapy to begin the process. He was like a celebrity. We knew he was coming. We went down to meet him when he got here, walked him up carefully, unpacked everything, and everybody's fingers crossed that it's still pink and perfused, and then you set to work with the therapy protocols. Sarah Bisher at Shriners was awesome. Matt Rose and the whole team at our UK Hand Therapy Center, they really are the ones that are able to facilitate a great outcome. We can give him his hand back if we're lucky, and we try hard, and we're ready to go, and the whole system works. But without that follow-up, that outpatient therapy, his range of motion is not the same. They put him through a range of exercises. Week after week, he would come multiple times per week. You got to force yourself to move it through the pain, and never seen a kid like him force himself to move it and not complain. It was incredible. He was very business-like. Went about his work with therapy, knew his exercises. His mom stayed on him doing the exercises at home. And I wasn't there to watch, but I know for sure, based on his improvement day after day, that she was. If you had 10 people who had that injury, right, 9 of them would not get the result that Levi got. So he has almost normal sensation, which is, it's just truly incredible. Everybody was at peak performance, from the EMT to the nurses to us to the therapists and to Levi and his home situation. He's a hardworking kid. He does the family chores. He helps build wood, build furniture from wood. He takes care of the animals on the farm, and really couldn't have been a better outcome all the way around.